Hello everyone. Today we are hosting special guest, Regina Maria. Tell us about the company, the vision, and a little bit about yourself, of course.
Okay. First of all, thank you very much for the invitation.
Our pleasure.
So I'm Fady Chreih. I'm the CEO of Regina Maria, the private healthcare network. We are the leading healthcare provider in Romania. And also I'm in charge of Medigroup, which is the largest healthcare provider in Serbia.
Mm-hmm.
In Romania, we are more than 10,000 people across the whole country. And we are an integrated healthcare operator, operating from labs to hospitals, imaging, outpatient, whatever is about healthcare needs. And also we have a subscription arm working with corporate clients to cater the needs for their employees.
Like insurance.
It's a very similar model. Mm-hmm. I know you have it in Poland as well. The subscriptions very similar to exactly the same popular model like in Poland. We have it in Romania as well.
Perfect, thank you. Can you tell us about what you're making in different way, or what is special to being so competitive like your company today?
So the whole value creation model of Regina Maria is very similar in thinking as a retailer, I would say, because 90% of our business is privately paid and only 10% of the business that we run is with the national health insurance, so with state funds. We have to think as a retailer. So we measure net promoter score, we measure stickiness, loyalty, all these measures that any company is looking at.
So customer experience is the king.
So yes, patient experience. We do make the difference between patient experience and customer experience. For instance, we look at patient pathways. We make sure that we strive to be as omnichannel as possible in our relationship with the patient. So I would say we are a digitally enhanced company. And we are one of the, let's say, most digital advanced healthcare organization in our region. We are extremely focused on offering a great experience, not only to customers, to patients directly, but also to our B2B partners. So we have different strategies, and let me put it like this, we have three big areas. What we do for our patients, what we do for our corporate clients or for our B2B, and what we do for our organization internally. Because having more than 10,000 people, you are a large organization, so you want to have productivity enhancement, and a lot of things that you can work yourself as an organization. So these are the, let's say, three building blocks. And this is how we look at business and how we look at how we work with different partners on digitalization.
Today we are visiting Microsoft Technology Center in Warsaw. We have discussion about the artificial intelligence. Everyone talking about the artificial intelligence. What is your position? What is your approach to AI? Do you expect something?
Look, yes, of course. We've just introduced Copilot in our organization. So
like
yes, I think I've been playing it on the free version of ChatGPT for quite some time. But now enhancing our productivity with using the Microsoft tools, it's really
pretty
working.
Amazing technology. Sometimes you can imagine that it's happening.
Doing the minutes on Teams, for instance, instead of searching or asking who is doing that, just by clicking a button is really helpful. And a lot of things that we are already using and getting accustomed with in such a short time, I would say, because usually the adoption of technology, it requires certain months or period of time. The adoption was immediate and instantly. But going back to AI, I think for us at Regina, our strategy is what AI does for medical part. So I'm talking about medical examinations, I'm talking about diagnostics, I'm talking about taking medical decisions. That's one component. And that's a completely different conversation and topic. And the other part is how can we enhance productivity? How can we enhance patient experience? How can we enhance patient pathways? And that relates to, let's say, non-medical activity of what Regina Maria is doing. So for us, it's very clear that we are talking about two distinct, let's say, paths from that perspective.
You mentioned many places when the artificial intelligence, especially generative artificial intelligence, can make some difference. If you wanna, indicate one, just one.
I'll give you one. 80% of our radiology exams are now AI enhanced. 80%. So we are already using AI in all our chest radiology, on our CTs, and on different areas where they have been medically graded and medically accepted. And we've been one of the first, if not the first one, to introduce, definitely in Romania and in the region, to introduce AI as a co-pilot, because I like the naming, for our doctors. So when I say they are AI enhanced, all our exams, it enhances the productivity of our doctors, it enhances the reliability of the medical exam and the medical diagnostic, and also the feedback from our doctors is amazing related to certain parts. So this is just one example of what we do.
If we take a look in the organization culture and the AI project, from your opinion, do you think that the toughest part is how to convince the people inside the organization how to use it, or maybe it's mostly technological part? I'm just trying to say that you should encourage your people to use that kind of technology. So we need more brave, or we need more technology understanding?
I think none of that. I think more of business case.
Okay.
What's the use case? How does the AI help us from a medical perspective or business perspective, or what friction does it solve? I mean, I think, and going back to your question of, what do you think about AI? We are beyond the hype, definitely. So it's not a hype thing like others have been, let me put it like this. It's definitely here to stay. It's definitely here to help us in business. In healthcare, for sure, because we are, as banks, millions of data, or like online shop retails and so on. So we have millions of data. And the question is, for us, is making sure that we have a business case. And what's the business case?
I like it. Last question. Do you see the future in bright or in dark?
I'm an optimist usually. So for me, the future is always in bright. If we are talking about technology, I think I'm one of the guys who is a believer that the babies who are born today will live definitely 100 years old, 110, 120, and so on. I think babies who are born even today in Warsaw, in Poland, they will be able to live that, because personalized healthcare, personalized genetics, personalized medicine is here to stay, and it will become a norm and a very normal thing in 15 years from now.
And maybe one question, what do you think about the place like this, Microsoft Technology Center, the Innovation Hub? Do you like it, that idea?
I'll tell you what I like about the Microsoft Technology Center of what I've seen so far. I always say that a leader has to, it's one of our responsibilities as leaders, we have to dream. And we have to know how to dream. This kind of technology centers helps us as leaders to understand how we should dream about the future of our company.
Ladies and gentlemen, it was a few dreams from CEO of Regina Maria.
Thank you.
Thank you.